Hello friends, I'm Physiotherapy and in this video, I'm going to answer top 8 questions that were asked in the comment section by you. So if you are interested in listening to my answers, then make sure to watch this video till the end. Let's begin. So friends, the first question that was asked was, can dry needling help in facial paralysis? So the answer to this question is, guys, it depends. Yes, in the initial phase of Bell's palsy, you don't need any kind of dry needling method to achieve any improvement in the movements. We have to wait for the natural recovery to happen for 90 days. However, if you have a very chronic facial paralysis with tremendous amount of facial tightness, where there are big knots that are present around the platysmal muscle, especially in that case, sometimes it can be used, but it's not a very common practice and it's very difficult to get therapist who does dry needling on the face, so it's better to refrain from it. Hello friends, hold on. There are a few more questions that I also wanted to answer, so watch out and hear me very carefully. So this question came, which asked that I am suffering from Bell's palsy. It's been 12 days. I have achieved good movements around my eyebrows. I am seeing some good movements around my smile, but my eye closure has not complete. Can you tell me how long it will take for my eye closure to come? Now, this is a very common question that a lot of people ask, and that's why I wanted to clarify this through this question. So, friends, as I've always explained you, your facial nerve is a nerve which starts from your brain, passes behind the ear, and then branches out in 5 branches like this. Now, if you can see, the fingers are of different length, right? Now, the longer the finger, the longer it is going for the nerve to heal or bring back the movement. Now, if I keep my hands this way, if you can see, the longest nerve is the one which is around your eye region, like this. That's why many a times people who suffer from Bell's palsy also experience delayed movement recovery around the eye and the eyelid region. That's when you observe that your eyebrow raise has come, your smile has improved, even you can observe that you are able to buckle, but your eye takes longer. Having said that, if you were someone who got eye movements earlier than other movements, then that's a very good sign. That means that your nerve is healing faster and you will see a faster recovery. Now, unfortunately, there is no predicting factors or timeline predictability on this. It totally depends on how sooner your nerve heals based on the medications that you have taken. If you have taken your medicines within first 72 hours, then your likeliness of recovery would be better. If your body's immune system is good, at that time you will see that the recovery is faster. If the type of virus that attacked your body was a milder form of virus, like Epsilon-Barr virus or is a common flu virus, then in that case as well, your chances of recovery are higher compared to someone who has been affected by viruses such as COVID, herpes simplex virus, or in that case, varicella zoster virus. Because in all three scenarios, it will fall into the category of Ramsay-Hunt syndrome, where the virus that has affected or has caused the Bell's palsy itself is a very strong virus, and it takes a long period of time for your body to heal. That's not all. If you are consuming food which is very high in sugar, which is very cold in nature, or as the temperature of that food is cold, or as if you are having very high saturated fatty acids, fried items and all, then it's going to cause more and more inflammation in the body and will affect your healing process. So, if you want faster recovery, then take care of these three things. Take your medications on time. Don't skip your medications at all. Number 2, make sure that your immune system is good, because your immune system is going to allow your healing to happen. And last but not the least, trust the process. It takes 90 days of time minimum for a nerve to heal. It's just that some people will recover faster, some people will take a long time. But there's no predictability to this, and that's why it is important that you wait and watch. So now let me move on to the next question. And this question says, if I have got synkinesis, how frequently I'm supposed to do exercises and how long I need to do these exercises? Well, the answer to this is the frequency of exercise has to be very minimal. Yes, you heard me right. The majority of time people make mistakes of doing very often exercise. They do exercises more than required, which is not the case in case of synkinesis or in case of Bell's palsy. Remember, you never used to think before making any facial expression. Do you? No, right? But suddenly when Bell's palsy happens, your entire attention falls on your face. You are more than conscious while making your facial movements, and you put a lot of conscious effort on doing this facial movements. Now, the more you do it, the more you are training your logical brain to function and send more neurotransmitters than required. And this is going to aggravate your synkinesis. So if you are someone who is suffering from synkinesis or Bell's palsy, try to limit your facial exercises maximum by 1 or 2 times. You don't need to do more than 2 times a day of exercise session. So I hope this answers your questions. I have Bell's palsy. I'm doing my acupuncture and I'm seeing some improvement. But do I need to take Botox? Well, friends, Botox is something that is not advisable in the initial phase of Bell's palsy. You don't need to go through a Botox therapy at the time when you are still healing. Botox as a therapy is for someone who has crossed around 6 months of timeline minimum, who has gained the maximum recovery possible, and has developed synkinesis. Again, Botox will not reduce or correct your synkinesis. The Botox will relax the muscles which are over-contracting and thus helps in symmetry the face. It will bring facial symmetry, it will relax the over-contracting muscles and thus helps the facial muscles to come back to the state of relaxation. That's the purpose of Botox therapy and not to bring back your nerve. So that's a misconception that Botox therapy helps in bringing back your nerve. So I thought that these 3 questions were very important that needs to be answered, and that's why I extended this video. I hope through these questions and the answers, you got a lot of clarity around your Bell's palsy recovery and the other topics as well. In the coming videos, I'll try to answer more questions around your comment section, or else we'll try to answer the comments at the same time. I hope to see you again in my further live sessions that we would be coming forward with. On that note, let's end this video here and see you in another video. Thank you.